So yeah, so that welcome to the expert group on mental health stigma and discrimination. So first of all, what we're doing here. So the aim of the expert group is to offer advice and recommendations on specific action needed to tackle mental health stigma and discrimination across Scotland. So through sharing, learning, investigating and analysing, the group will form an overall list of priority actions that we determine need to be taken forward. In addition, the group will also help with advising on the formation of a delivery collaborative. So this is to support kind of ongoing transformational change and collaboration through a lot of coordinated action on stigma and discrimination. So that would kind of the next part of this, which might then involve some of the members of the group, but certainly helping on advising of the forming of that. Um, why we're doing this. So it's a few different reasons. The new mental health and wellbeing strategy has a really strong focus on stigma and discrimination. That's in the vision, the outcomes, the priorities as well. And we think at CME that now is a kind of ideal time to capitalize on this and create some measurable, accountable action that's going to really make a difference. Addressing stigma is also a key priority in both the suicide prevention and the draft self-harm strategies and action plans as well. We think that work to tackle stigma and discrimination needs to reach more people. We've kind of reached a lot of people, and there have been a lot of changes around stigma and discrimination, a lot of improvements, but there's certain um, people that get missed time and again. So we want to look at how we can improve that. There's need for more work to improve the lives of those with mental illness and from systematically marginalized communities. We think that we can have a bigger impact if there's buy-in and leadership from across different sectors and from different organizations as well. Um, Another piece of the research Simon mentioned there at the beginning, the Scottish Mental Illness Stigma Study. So this was the kind of biggest study that's been done in Scotland into the specific experiences of stigma and discrimination experienced by those with more severe, complex and enduring mental illness. And it looked at 14 different life areas and what the stigma and discrimination people experienced there was and what the impact that was as well on them, kind of withdrawing from lots of different areas of life as well. And that particular bit of research, we've kind of, I guess, punted that far and wide, and it's got a real interesting commitment from a lot of different partners too, who have seen how important this work is and the impact that stigma and discrimination is still having. And there's also a real understanding in the Scottish Government and the Mental Health Directorate that we need to increase attention to ending stigma and discrimination. So I guess, yeah, now we just kind of think it's the ideal time to really get a lot of reach with this work and to do this well. We want to do it with a range of different people and kind of coordinate work nationally and working with key stakeholders, not just in kind of the execution of what we're doing, but also in figuring out what we need to do too. So there's a few things that we want the impact of this to be. So the Scottish Government currently has a draft out of their mental health and wellbeing strategy delivery plan, and in the current draft it's got there to work with this expert group, which will be led by CME, to identify, implement and evaluate key cross-cutting actions needed to address stigma and discrimination for those who experience it most. So there's kind of already a real kind of understanding commitment at this stage in the strategy, the draft one, that this is a really important group and an important piece of work. But further than just this strategy, we want this group to develop an action list which can be used as foundations for national work going forward. So we want the group to develop actions that will, I suppose, help to form the work of the government on tackling stigma across policy and sectors. It will guide what action needs to be progressed by CME as the national programme, to also consider what actions need to be taken forward by other organisations, charities, agencies, services, and that will likely include lots of people who are within the group as well, and to also ensure inclusivity and equity for people with mental illness and mental health problems when accessing and engaging support with services. We kind of know as well all this needs to be done while considering tight budgets across sectors and across government as well, and that the actions we come up with need to be proportionate and reasonable and measurable to show the change. But we also want this to be aspirational. We want this to be a group and a piece of work that does create change. There's kind of no point in us doing this if it just continues with what's been happening already, because the same people who aren't being helped will continue not to be. Um, and we know that there's kind of not really extra money available uh, around mental health budgets as well, which doesn't make this an easy task. So that's why I've brought people together who we think can both influence others to tackle stigma, but also could or already are doing work which tackles mental health stigma, but perhaps isn't explicitly thought of in that way. So the actions we develop over these sessions, some will be taken forward by CME as a national programme, some may form enhanced work done by other organisations, including some of yours, and we may come up with actions that can also be delivered by others, and we can start to think about and establish who with the kind of idea of the delivery collaborative. But what I guess is really important, I wanted to set out at the beginning of this, is that we don't just want to limit the thinking aspirations of this group to what we can just do ourselves or just what CME can do. But what we really want to do is to kind of hear from you on what it is that needs to be done, not just what can be done under the current circumstances. And when we know that, we can then really look at, right, how can we do this and how can we create real change? So this expert group is stage two of a three-stage strategic approach that CME's been working to. So stage one was to influence the national strategies and secure a commitment to tackling stigma, using evidence, including the Smith study as well. Stage one also kind of involved securing a policy sponsor for the expert group, who work alongside CME to help ensure that the actions and the influence for change can be across policy and across government portfolios. And will also kind of help with the involvement of strategic partnerships and working out organisations best placed to create the actions. Stage two is the expert group, where we look at what action is needed. And then stage three, as mentioned there, is to form a delivery collaborative, and that will be a group that will support joint planning and delivery of the actions to support change at different levels across the system. It's likely to be a lot of crossover with this group for as many people who want to be in that, but also looking at who else we need to work with to deliver things. We also thought it might be quite helpful because there's such a across the expert group, there's a real range of knowledge and experience of so many different areas. Some people who work in or have personal experience of mental health problems, but many who don't as well. So we thought it might be to helpful to set the context as to what we're talking about when it comes to mental health stigma and discrimination. 'Cause obviously stigma and discrimination impacts a lot of people for a lot of different reasons, but to kind of help set the context of what we're looking at here. So mental health stigma is the negative attitudes or beliefs based on a preconception, misunderstanding, or fear of mental health. So an example of this might be someone incorrectly thinking that all people with mental health problems are dangerous just because they've seen it in a film or on the news. Mental health discrimination is when a person performs an action, whether intentional or unintentional, that creates barriers and an inequality for people with experience of mental health problems. So this might be someone not getting invited for a job interview based on disclosure of a mental health problem. There are a few different types of mental health stigma that we're kind of looking to tackle as well. So self stigma, which is the judgment people put on themselves. And this has often come from hearing and seeing external stigma and discrimination. And it can really lead people into believing that they aren't capable of things such as getting a job or going into further education, which can result in them withdrawing, feeling frustrated, angry, experiencing low self esteem, and a lack of confidence as well. And the Smith study certainly highlights a lot of that. Stigma by association, which is when someone connected to people with mental health problems, like family members or friends, can experience stigma as a result of this association. Structural stigma, which is when the rules, policies, and practices of social institutions can restrict the rights of and the opportunities for people with mental health problems. So, this could be a policy at work which automatically puts people with mental health problems at a disadvantage due to the wording or the terms. And then public stigma as well. So, this can also be known as prejudice, and it's when people form an opinion before judgmental preconceptions. Just that they endorse stereotypes which are already out there and have a major impact on someone experiencing mental health problems across various different areas of their lives. So, with that as the context, just looking at what's going to happen over the 3 sessions. So, I guess there's 2 session 1s, this being the second of the two. Um, uh, so what we're looking to do is to hear what you think needs to be done, to see what the strategies say about stigma and discrimination, the government strategies, to look at a self-assessment of stigma in Scotland, which we've put together, to look at what Seeing Me is doing already, to consider the Scottish government's workforce and equality and diversity plans within the mental health strategy, then to kind of look at action areas and create an action list. So in this first meeting, we're going to have a little look at what you think needs to be done to tackle stigma, look at what the government strategies say, look at the self-assessment as well, and then there'll be loads of time for kind of reflection and debate throughout the session too. So we've got short presentations at each section from CME team members before going into kind of group conversations. I think given the size of the group, we'll probably just do it as one group this afternoon. Um, Also, know that these discussions can be quite difficult around mental health and stigma and discrimination, can potentially be triggering as well. So if you do need to chat or to just kind of step away for a little bit, we can just give me a message, and we can also set up a breakout room as well. I'll come along and chat with you there as well. We've also come up with this. This is something that CME's had kind of through doing lots and lots of various different meetings. Is this kind of sort of group contract or some kind of ways of working together, which you've got here is kind of having one speaker at a time to monitor your airspace, which is largely around sort of ensuring that everyone gets time to speak, to seek to understand first, to share ideas, but also on a personal sharing as well. That questions are always encouraged, and to be as present as you can. This is clearly also a slide from when we were in the room with people to put phones and laptops away. We know that's not always possible, and I really don't want everyone to put their laptop away because then you'll all just leave the meeting. And so it doesn't really work on an online thing. But yeah, but does this work for people? So this is something that CME's done, but keen if anyone's got anything they'd like to change or add or reflect on in that. Cool. Hear anything? Great. So,
Nick, Imran's
yeah.
hand's raised.
Sorry. Hi, Emma.